So the developmental needs of a premature infant are different from a typical newborn. Developmentally, they should still be in utero, and the NICU atmosphere is often overstimulating. We want to reduce noise, lighting, and minimize stimulation, especially for those very preterm infants. Shield their eyes from bright lights. They need to be handled with slow, controlled movements, and let them know, use a soft voice to tell them we're about to touch them. Skin to skin contact and gentle massage, as tolerated, promotes neurologic development, improves respiratory and cardiovascular stability, temperature regulation, and increases weight gain. It also promotes bonding. But remember, we've got to get them to the point that they can tolerate that. So a 23-weeker is not going to tolerate skin-to-skin contact typically. They need to be handled very little and very gently in a dark, comforting atmosphere that mimics the uterus as much as we can. As that infant becomes more stable, then we want to promote skin-to-skin contact. And again, just try to mimic that womb environment as much as possible. As they mature and stabilize, then interventions are added to support and encourage development. Families of premature infants have a lot of feelings and a lot of things going on. The families are usually anxious. They may be afraid of the equipment. They may be afraid about losing that infant. They may have guilt about how sick the infant is, or about how much time the infant takes that's taking away from other responsibilities. So if they have other children, if they have jobs, if they have other people that depend on them, they may really struggle with the guilt of not being able to do everything. Parents may be reluctant to bond with that child because they're afraid of grieving. Bonding can also be difficult because of decreased contact, and the needs of that infant are challenging. We want to make sure that patients, that if at all possible, before a preemie is transported away from the parents get a chance to have contact. They get a chance to see and touch that baby. We want to promote bonding by including the infants or the parents in care of the infant. We want to explain procedures and why they're being done, prepare them for all the equipment and for what that baby is going to look like. Promote visiting, promote ways for them to stay nearby. And then as the infant is able, we want to promote touching and handling and kangaroo care. Kangaroo care is just the baby spending time skin to skin with someone, usually like inside their shirt, something like that, on the chest. Discharge planning. Preemies may be discharged home with medical needs, and parents need to know how to take care of that infant and feel comfortable doing so. In the last few weeks or days of admission, a lot of hospitals actually have a place for parents to stay so that they're staying on site, doing most of the care for that infant and learning how to get comfortable with it before they're discharged. Car seat safety looks a little bit different. Traditional car seats, because they're more upright. If the baby's not able to maintain their head in an upright position, it can fall forward. It can fall forward enough to constrict the airway. So they're going to have to do a car seat safety test to make sure that the infant can maintain breathing and oxygen saturations in the car seat, so they can be in the car seat safely. If they cannot, there are special car beds that can be used. Preemies have an increased risk for SIDS. Patients need to be taught about that. And we need to make sure that they're going to get appropriate follow-up. They need appropriate medical care, but they also need someone they can call with questions or needs. So telephone availability and callbacks are important. In the next section, we're going to talk about some of the complications of prematurity.